Welcome to Truth and Wellness, where we're committed to uncovering the real strategies behind lasting health transformations. I'm your host, Pavel Grey, and today I'm thrilled to introduce our guest, Dr. Kent, a doctor of pharmacy and glutathione expert who's devoted his career to health optimization.
Hello, everyone, and welcome back to another exciting episode of Truth and Wellness. I'm your host, Pavel Grey, and today we're diving into a topic that has sparked a lot of discussions and debates in the health and wellness community, glutathione and its role in cancer. Joining me is the ever-knowledgeable Dr. Kent, who's here to help us navigate this complex subject. Dr. Kent, welcome back to the show. It's always a pleasure to have you here.
Thank you, Pavel. It's fantastic to be back. I'm really excited to tackle this topic today because it's such a nuanced and critical area in the field of medicine and wellness.
Absolutely. Before we delve deep into the role glutathione plays in cancer, perhaps we should start by giving our listeners a quick overview of what glutathione actually is and why it's important for our health.
Great idea. Glutathione is a powerful antioxidant found in every cell of our body. It's sometimes called the master antioxidant because it plays a crucial role in combating oxidative stress and supporting immune function. It helps neutralize free radicals, which can damage cells and contribute to diseases, including cancer.
That sounds pretty significant. So, in the context of cancer, there's a lot of debate about whether glutathione is beneficial or potentially harmful. Can you shed some light on why there's such a divide in opinion?
Certainly. The debate largely centers around glutathione's dual role. On one hand, its antioxidant properties can protect normal cells from damage and boost the immune system, which is a good thing for cancer prevention and overall health. On the other hand, because it protects cells, it can also safeguard cancer cells, potentially aiding their survival and growth during cancer therapy. This is where it gets complicated because you want to support the body's natural defenses without inadvertently helping the cancer. Let me explain this in the simplest way possible because the answer is not what most people expect. The simple answer: glutathione is safe and actually protective for people in cancer remission. Here is why. Most people think like this. If glutathione feeds cells, and cancer is cells growing out of control, then glutathione must feed cancer. That logic seems right, but it is backwards. Let me explain why. Low glutathione causes cancer, not high glutathione. People with low glutathione levels have significantly higher cancer risk. This has been proven in thousands of studies. In fact, people with abnormal glutathione genes, who cannot make enough glutathione, are particularly susceptible to cancer. Think of it like this. Glutathione is your body's security guard. It protects your cells from damage. When security guards are missing, bad things happen. Cells get damaged. DNA gets damaged. Cancer starts. Low glutathione allowed those cancers to develop in the first place.
What about cancer cells themselves? But before you answer, let's take a brief break to hear from our sponsor.
This episode of Truth and Wellness is proudly sponsored by Immunotech, your trusted immune health partner for over 45 years, offering cutting-edge glutathione research and a thriving global community to support your journey to healthier, happier living.
Here is where it gets interesting. Cancer cells already have very high glutathione inside them. They make extra glutathione to protect themselves from chemotherapy and radiation. That is why some cancers are resistant to treatment.
So, if cancer cells already have high glutathione, how does giving more glutathione precursors help?
Selective modulation, the magic part. This is the breakthrough discovery. Let me explain it simply. When you give glutathione precursors like bonded cysteine and immunocal, something amazing happens. Healthy cells, they raise their glutathione levels. They become stronger and more protected. Cancer cells, they lower their glutathione levels. Why? Because cancer cells already have so much glutathione that when you give them precursors, it triggers a shutdown mechanism. The cell says, I already have too much glutathione. Stop making more. Think of it like filling water bottles. Your healthy cells are water bottles that are half empty. When you pour water in, they fill up. Cancer cells are water bottles that are already overflowing. When you try to pour more water in, the overflow sensor shuts off the faucet. The water level actually drops. The result? Healthy cells become more resistant to damage. Cancer cells become less resistant to damage. This is called selective modulation. It is the opposite of what people fear.
Is there any clinical proof of this?
Yes, of course. Dr. Jimmy Gutman, the leading glutathione researcher in the world, did a gold standard study on late-stage lung cancer patients. These patients were already dying. They had lost significant weight and muscle mass. Half the patients got immunocoal-bonded cysteine, half got placebo. The results? The immunocoal patients reversed their weight loss and muscle loss. First time in history any nutritional intervention did this. The immunocoal patients had better quality of life. 1 year later, 80% of immunocoal patients were still alive. Less than 50% of placebo patients were still alive. Dr. Gutman has stated publicly, "I have never found a single study where raising glutathione in human cancer patients backfired. Not one. People in remission or trying to prevent cancer, that means no active cancer right now. Low glutathione is what allows cancers to develop. Keeping glutathione low increases the risk of cancer developing or coming back. Restoring glutathione protects against cancer recurrence because it protects healthy cells from DNA damage that causes cancer. It supports immune function to detect and destroy abnormal cells before they become cancer. It reduces chronic inflammation that drives cancer development. If any microscopic cancer cells exist, selective modulation makes them weaker, not stronger." Bottom line, glutathione does not feed cancer. Low glutathione causes cancer. Restoring glutathione protects against cancer recurrence and improves survival if cancer returns. People should be restoring glutathione, not avoiding it.
So, how should researchers and practitioners go about this?
Well, it can depend on many factors, including the type of cancer, its stage, and the treatment being used. In some cases, supplementing with glutathione might be beneficial as an adjunct therapy, where the focus is on using it to reduce side effects of chemotherapy and improve overall well-being. However, there's a cautious approach in active cancer treatment phases, especially where the aim is to maximize oxidative stress on cancer cells to cause their death.
That makes sense. It seems critical then that both patients and practitioners are well informed and work closely together when considering glutathione as part of a treatment plan. Are there any particular studies or real-world cases that highlight the effectiveness of glutathione in a therapeutic setting?
Yes, indeed, there have been studies showing that glutathione can help reduce the toxic side effects of chemotherapy drugs like cisplatin and doxorubicin, which are notoriously tough on the body. For instance, some patients have reported lessened neuropathy, a painful nerve damage side effect during their chemo cycles. These findings are promising as they open the door to potentially improving quality of life and adherence to treatment regimens, which is crucial.
That's intriguing. It sounds like there could be a significant impact on patient comfort and their ability to stay the course with treatment. I imagine, though, this needs a lot of individualized planning.
Absolutely, Pavel. Each case is unique. Factors like the patient's overall health, genetic markers, specific type of cancer, and current treatment plan all need to be taken into account. This is why regular communication between patient and healthcare provider is essential to adjust support therapies like glutathione supplementation appropriately.
For sure. I'm curious, Dr. Kent, do you have any personal anecdotes or experiences from your practice where glutathione played a pivotal role in a patient's cancer treatment journey?
I do have a few, actually. One that stands out is a patient with ovarian cancer who was on a demanding chemotherapy schedule. We incorporated glutathione supplementation to help mitigate the severe nausea and fatigue she experienced. Not only did it improve her immediate symptoms, but it also allowed her to maintain her strength throughout her treatment, which psychologically boosted her fight against the disease. Anecdotal cases like these are powerful, although we always need to remember they are not one-size-fits-all solutions.
That's a compelling story, and it underscores how holistic approaches can sometimes add significant value to conventional treatments. Let's talk a bit about the future. Are there any areas of ongoing research or emerging studies that our listeners should keep an eye on? You know, the kind of developments that might redefine how we look at glutathione and cancer in the coming years?
Yes, there's definitely a lot of exciting research underway. One promising area is the exploration of selective delivery mechanisms where glutathione or its precursors could be targeted specifically at healthy cells, or alternatively, using nanocarriers to enhance its bioavailability in ways that mitigate risks of inadvertently supporting cancer cells. Another intriguing line of research is investigating genetic variations that might predict how different individuals process glutathione, which could lead to more personalized approaches in its application.
Wow, it's fascinating to think about how personalized medicine is evolving. potentially offering much more tailored health solutions down the line. Given everything we've discussed today, what key advice would you give to our listeners who may be considering using glutathione as part of their wellness or cancer management strategy?
My main piece of advice would be to have open and ongoing conversations with their healthcare providers. It's critical to discuss all supplements and alternative therapies being considered. Don't be afraid to ask about the evidence, potential risks, and benefits specific to your personal health situation. It's through informed discussions that the most effective and safe health strategies can be developed. I will also include a link for a 5-day sample kit of the original Immunochol and NRF2 flavor booster for people that want to get a feel for the taste and practice mixing the product before they commit to a monthly supply in the description section of this podcast.
That's the kind of guidance that can genuinely empower individuals on their wellness journeys. Dr. Kent, thank you so much for joining us today and for sharing your valuable insights into glutathione and cancer. It's been a truly enlightening conversation, and I'm sure our listeners have benefited greatly from your expertise.
Thank you for having me, Pavel. It's been a pleasure, as always, to be part of Truth and Wellness. I hope our conversation today helps listeners make more informed decisions about their health.
Absolutely. And to our listeners, don't forget to subscribe to Truth and Wellness if you haven't already, and feel free to send us your questions and thoughts. We always love hearing from you. Until next time, take care of yourselves and each other. Goodbye.
Thanks for tuning in to the Truth in Wellness podcast, where your journey to mastering wellness begins.